September is Recovery Month, and substance abuse is a real problem in this country. That's why we're happy to be joined today by Cassie Kosowski, the founder and lead addiction counselor of Beths Place, a non-residential treatment facility. Cassie, welcome to the show.
Good morning. Thank you for having me.
Well, before I jump into asking you how people can get a chemical use assessment, can you start by just telling us a little bit more about Beths Place?
Yes, so Beth's Place has been open now for 2 years this September. So we're a non-residential level of care. And what that means is we have treatment 5 days a week, but people go home after they are done with treatment, go back to where they reside. So we're not an inpatient facility.
Okay. So a couple of more questions then, because I find that interesting, kind of the difference and how that is still beneficial for people. How does someone go about seeking a chemical use assessment at Beth's Place?
So there's a couple different ways. So you can actually book online at bethsplacerecovery.com. So that basic comprehensive assessment is really going to assess your level of care and what's beneficial for you at that time. So at that time, we go through 6 different dimensions and look at what would benefit you. So if you need residential level of care, or if an outpatient level of care would assist you, or relapse prevention. So at that time, then we'll send you on, or we'll set you up with Beth's Place, whatever would best suit you for your to get you sober.
Do you have to be referred to have that assessment?
No, you do not need to be referred. We have a lot of primary care physicians that do refer to Beth's Place, but you do not need a referral. You do not need a referral at this time. You can just call and set that up as well.
Okay. So what does the treatment process look like, especially breaking down the difference between non-residential and residential, because this seems like it would be a really great option for a lot of people.
It is. It's a really good option for a non-residential level of care because a lot of people can't step away from work for an entire month to go into an inpatient facility. So what that looks like is you would be in programming typically from 9:30 to 12:30, 4 days a week or 5 days a week. And at that point, we would assess you, and you're probably going to be in treatment for about 10 weeks is typically the average, but really it's person-centered, so it's going to go off of what the person needs. So we're going to be looking at specific goals that each patient hits. So say your goal is to get a job. Well, then you can't be at treatment every single day, and we'd rather have you be working if you're remaining sober and you're integrated back into society. And kind of hitting the goals that you want. So it really depends, and it's really different for every single patient.
Now, if people are watching at home, and you talked a little bit about getting the assessment, what would be some signs, symptoms that people should be watching out for if they're thinking, maybe I do have a substance abuse problem, but I don't know if it's enough to take this step?
We have a lot of people that come in on their own, and we have a lot of people that maybe have gotten multiple DUIs or they're referred from probation. So it's going to look different across the board. So what I always tell people is you always know yourself, right? We know if we're drinking every single night, if we're using illicit substances, that we really shouldn't be. So that aha moment with yourself to check in to say, I'm not able to quit this on my own. Are you able to go a couple days without using substances? A lot of times people say, well, I'm maintaining a job. I'm maintaining a job and I'm not hurting anybody, right? But you're still consuming a bottle of wine a night or 2 bottles of wine a night. Is it affecting you in your day-to-day and your thoughts and your mental health? Are you having an increase in depressive symptoms? What does that look like for you?
Do you take insurance? And what if you don't have insurance that covers something like this?
Yes, we do take insurance. We take most insurance coverage at this time. And then we also have the ability to go to the county and ask for funding. If someone doesn't have insurance and they meet specific guidelines, Clay County is amazing for that. And then say all of that doesn't work, then we do work out a payment plan. We typically do not turn people down. To be admitted to care. Insurance and payment isn't really a driving force. We just really want to get people better and get them integrated into treatment, and then we kind of figure out the finances later if we need to.
So it can be a tough situation, a tough place to start and make that commitment, but I would imagine you have some success stories. Can you talk just a bit about what you hear from people at the end of treatment?
Yes, we have a ton of success stories. We're so fortunate. And the FM area is so loaded with so many amazing counselors and therapists. And a lot of patients come in and say, I didn't know I was doing this. I didn't know that I was living so chaotically. I didn't know that my family cycle was maybe not the most healthy. We have a lot of codependency. We see a lot of trauma. And a lot of times we just keep going. We have that North Dakota nice where people say, how are you? And you say, I'm fine. And you? When really you're struggling across the board and you need someone to help you get some skills and to be at peace.
Yeah, you kind of touched on it. Sometimes it's almost kind of a stigma. We don't want to have that conversation and we don't want to admit it. But if there is an issue, this is a great place to start making the change.
Absolutely. And there is a huge stigma for addiction and mental health. And I always tell people, shake your family tree. Someone is going to fall out of there that suffers from addiction. Addiction looks different across the board. It doesn't always have to be alcohol or methamphetamine. It could just be an addiction to food or working too much. There's lots of different things that we all need to struggle with to get back in balance.
Cassie, how do we get a hold of you?
So the best place to get a hold of us if you want to book a comprehensive assessment is going to be at bethsplacerecovery.com, or you can also call the clinic at 701-566-9965, and we can better assist you with any questions.
Cassie, thank you so much for your time today. I appreciate it.
Thank you.
Stay with us. Coming up next, we're talking about why real men wear pink.